So how do we know? When we look at the lesion, how do we know that the lesion is malignant or not? There are basically three ways we can do that, okay? First one is because I've seen this lesion before. Okay, this is based on experience. I've worked with this lesion before. I know exactly what it is. I know the diagnosis and I know it's malignant. I know its behavior and everything about it, okay? Number two, I haven't seen the lesion before. However, I know that the patient presents with metastatic disease, okay? So the nature of the lesion, even though I haven't seen it before, I know already off the bat, okay, that it is malignant. So what if I have not seen the lesion before and I know nothing about the patient's history? So there are two ways we can decide whether the lesion is malignant or benign, okay? So these are low power features and high power features, and for those who wants to be a little fancy with the terminology, these are architectural features and the other ones are cellular features, okay? So the first one is the architectural effacement. Is the lesion effacing the architecture or not? The other one is the cellularity, okay? Are there too many cells or not? The other thing is three-dimensionality. Are the lesions, are the cells, lesional cells on top of each other or not? The usual normal tissue usually form monolayers of cells. The other thing is, do we have any necrosis in the background, okay, or the death of many cells? Do we have any substances that do not belong in these organ or systems, like, for example, thyroglobulin or amyloid or mucin or things like that? And now when we go to the cellular features, the usual ones, we have the NC ratio, increased cellularity, increased apoptosis, abnormal mitotic figures, especially tripolar mitosis. We also can have infiltrative growth pattern, okay, if the cells are actually infiltrating the tissue architecture. If they extend into another organ, we can basically predict that we're dealing with a malignancy, especially if the malignancy also shows a extensive lymphovascular invasion. So these are some of the features. This is not an exhaustive list, but these are pretty much the main ones.